pediatrician. We moved here as a family about 9 years ago, and I've chosen to raise our children in the same community where I practice, which has given me a big understanding of our schools and all of the local events. I trained here in the Bay Area down at Stanford for pediatrics, and this has been my first job in private practice since I left. Our practice, Summit Pediatrics, is unique for the area in that we've chosen to stay relatively small. We have 4 practicing doctors, and we've tried to keep the practice, if you will, as 1950s as we can. We've managed to avoid having a phone tree. We daily try to see every patient who needs to be seen, and we really find that by being small, we have a really good relationship with the families, and it allows us to know them and practice medicine to the best of our ability. I think it's real to say that it was a scare. This is, in my career, the first real emerging illness that we've had to deal with on a daily basis with regard to our access to information and our understanding. And I think that it's nice that we have the technology now to get information around the country and around the world as quickly as we can. We chose to give the vaccination as quickly as we could, and we were actually featured on the news as one of the first local pediatrician offices and really medical offices to have that. One of the reasons for that is there's quite a bit of information showing us that children are some of our most vulnerable patients, and so there was a real push to get the vaccine to children and the pregnant mothers who are thought to be at the highest risk. And so we trusted the vaccine. It was produced in the same production places that they produced the regular flu vaccine under the same similar situations. And so we embraced it, we got it, we stayed up late and we gave it, and we were happy to see that most of our families wanted the vaccine, were educated about its risks and its benefits, obviously, and came out and had the vaccine. We gave over 2,500 doses over the course of about 2 months, and we were pleased with the results. We tell everybody at our practice that we are a pro-vaccination office. Everyone in our practice believes that vaccines are safe, that they save lives, and that they prevent childhood illnesses. And so we talk a lot because there are a lot of people out there with questions and concerns, most notably autism. The thing that strikes me most when I talk to parents about autism is what we don't know. And I always feel like until we can really tell you, here's what we know definitively, there's a lot of fear and a lot of worry. And so I understand that. But in looking at vaccines as a cause for autism, I'm a firm believer that vaccines are not a cause of autism. And there's some very powerful studies that have been repeated through the National Institute of Medicine, which is thought to be a completely detached site from pediatrics in terms of looking objectively at the literature and the data that's out there that really refutes any of the claims that vaccines are related to autism. We also have the Lancet, which initially published an initial article by Dr. Wakefield that has now formally retracted that article from being something that's valid. So I share that with families, and I share with them my thought, and you hope that you can share with them trust, that they have to trust, because at some point I think people do have to trust, and that's a hard thing. But we continue to work on it, and obviously continue to support all the people out there through Autism Now and the Mind Institute and a lot of our local places that are really struggling to figure out what is causing this and how to best address it early in life, because it does respond to intervention. The way we've studied our vaccines and their efficacy is by giving them at a set schedule and a set interval dose with boosters, and that's how they've all been studied in terms of outcomes for immunity and ways of protection. And so one of the ways that people have started to address this fear about vaccines, whether it's giving too many at once, effects on the immune system and all of these other theories that are out there, is to come up with modified schedules. And while it's not the primary concern, because right now most people are just struggling to convince people to get their children vaccinated entirely, it's something that remains to be studied, is by doing any of these modified schedules, are we in a sense putting kids at greater risk for the vaccines not being as efficacious?